Good afternoon. Today we have a new topic. The name of this new topic is a chemical emergency. Now, table of contents. The first one, introduction. The second one, chemical injury, which includes symptoms of chemical poisoning, first aid treatment for chemical burns, first aid treatment for chemical eye burn, first aid for inhalation poisoning, and first aid for poisoning by swallowing. Third one, pre-hospital management, which includes hot zone, decontamination zone, and last one, support zone. So, introduction. Chemicals are an important part of life. Chemicals are a natural and important part of our environment. Even though we often don't think about it, we use chemicals every day. Chemicals help keep our food fresh and our bodies clean. They help our plants grow and fuel our cars. And chemicals make it possible for us to live longer, healthier lives. Under certain conditions, chemicals can be poisonous or have a harmful effect on your health. Some chemicals, which are safe and even helpful in small amounts, can be harmful in larger quantities or under certain conditions. You may be exposed to a chemical in three ways: breathing the chemical, swallow contaminated food, water, or medication, touching the chemical, or coming into contact with clothing or things that have touched the chemical. Remember, you may be exposed to chemical even though you may not be able to see or smell anything unusual. Many people think of chemicals as only those substances used in manufacturing processes. But chemicals are found everywhere in our kitchen, medicine cabinets, basements, and garages. In fact, most chemical accidents occur in our own homes and they can be prevented. So, chemical injury. Symptoms, symptoms of chemical poisoning. There are several symptoms of chemical poisoning, whether by swallowing, touching, or breathing. Difficulty breathing, changes in skin color, headache or blurred vision, dizziness, irritated eyes, skin, throat, unusual behavior, clumsiness or lack of coordination, stomach cramps, or diarrhea. If you see or smell something that you think may be dangerous, or find someone who has been overcome with toxic vapors, your first job is to make sure that you don't become a victim. If you remain in a dangerous area and become injured or unconscious, you cannot help yourself or any victims. First aid for chemical burns. A chemical burn can be minor or life-threatening, but proper treatment can reduce the chance of infection and the damage caused by contact with the chemical. Remove any affected clothing or jewelry from the injury. Use lots of cool running water to flush the chemical from the skin until emergency help arrives. The running water will dilate the chemical fast enough to prevent the injury from getting worse. Use the same treatment for eye burns and remove any contact lenses. Be careful to flush the eye from the nose outward. If no large amount of clean water is available, Gently brush the chemical off the skin and away from the victims and you. If the chemical is on the face, neck, or shoulders, ask the victim to close his or her eyes before brushing off the chemical. Cover the wound very loosely with a dry, sterile, or clean cloth so that the cloth will not stick to the wound. Do not put any medication on the wound. Seek medical attention immediately. If medical help is not immediately available, remove your clothing starting from the top and working your way down to your socks. Take care not to touch your contaminated clothing to your bare skin. Place your clothing in a plastic bag so it cannot contaminate other people or things. Take a thorough shower to wash any chemical away. Redress in clean clothing and go for medical help and your first opportunity. First aid for chemical eye burn, self-care at home. For all chemical injuries, the first thing you should do is immediately irrigate the eye copiously. Ideally, specific eye irrigating solutions should be used for this, but if none are available, regular tap water will do just fine. Begin washing your eye before taking any other action and continue for at least 10 minutes. The longer a chemical is in your eye, the more damage will occur. Dilating the substance and washing away any particles that may have been in the chemical are extremely important. Ideally, in a work setting, you would be placed in an emergency eye wash or shower station and your eye washed with sterile isotonic saline solution. If sterile saline is not available, you could tap water. If you are at home and do not have special eye wash, step into the shower with your clothes on to wash out your eye. Even though it may be uncomfortable, open your eyelids as wide as possible as you rinse them out. If an alkali or hydrochloric acid burn has occurred, continue washing until a doctor arrives or you have been taken to a hospital's emergency department. First aid for poisoning by swallowing. Check and monitor the person's airway, breathing, and pulse. If necessary, begin rescue breathing and CPR. Try to make sure that the person has indeed been poisoned. It may be hard to tell. Some signs include chemical smelling breath, burns around the mouth, difficulty breathing, vomiting, or unusual odors on the person. If possible, identify the poison. Do not make a person throw up unless told to do so by poison control or healthcare professional. If the person vomits, clear the person's airway. Wrap a cloth around your fingers before cleaning out the mouth and throat. If the person has been sick from a plant part, save the vomit. It may help experts identify what medicine can be used to help reverse the poisoning. If the person starts having convulsions, give convulsion first aid. Keep the person comfortable. The person should be rolled onto the left side and remain there while getting or waiting for medical help. If the poison has spilled on the person's clothes, remove the clothing and flush the skin with water. First aid for inhalation poisoning. Call for emergency help. Never attempt to rescue a person without notifying others first. If it is safe to do so, rescue the person from the danger of the gas fumes or smoke. Open windows and doors to remove the fumes. Take several deep breaths of fresh air and then hold your breath as you go in. Hold a wet cloth over your nose and mouth. Do not light a match or use a lighter because some gases can catch fire. After rescuing the person from danger, check and monitor the person's airway, breathing, and pulse. If necessary, begin rest breathing and CPR. If necessary, perform first aid for eye injuries, eye emergencies, or convulsions. Convulsion first aid. If the person vomits, clear the person's airway. Wrap a cloth around your fingers before cleaning out the mouth and throat. Even if the person seems perfectly fine, get medical help. Do not do not give an unconscious person anything by mouth. Do not induce vomiting unless you are told to do so by the poison control center or a doctor. A strong poison that burns on the way down the throat will also do damage on the way back up. Do not try to neutralize the poison with lemon juice or vinegar or any other substance unless you are told to do so by the poison control center or a doctor. Do not use any cure-all type antidote. Do not wait for symptoms to develop if you suspect that someone has been poisoned. Pre-hospital management. The route and extent of exposure are important in determining the potential for secondary contamination. Victims who were exposed only to gas or vapor and have no gross deposition of material on their clothing or skin are not likely to carry significant amounts of chemical beyond the hot zone and are not likely to pose risks of secondary contamination to response personnel. However, victims whose skin or clothing is soaked with liquid chemical or victims who have condensation or chemical vapor on their clothes or skin may contaminate others by direct contact or by off-gassing vapor. If the victim has ingested a chemical toxic vomitus may also pose a danger to others through direct contact or off-gassing vapor. Hot zone. Rescuers should be trained and appropriately attired before entering the hot zone. If the proper equipment is not available or if rescuers have not been trained in its use, call for assistance from a local regional hazmat. Hazmat it means hazardous materials and items. Hazmat teams or other properly equipped response organization. Rescue protection. When a chemical is unidentified, unidentified worst-case possibilities concerning toxicity must be assumed. The potential for severe local effects like irritation and burning and severe systemic effects like organ damage should be assumed when specific rescue protection equipment is selected. Now, a short coffee break. So let's have continue. Respiratory protection. Pressure demand self-contained breathing apparatus (SCBA) should be used in all response situations. Skin protection. Chemical protective clothing should be worn when local and systemic effects are unknown. ABC reminders. Quickly ensure a patient airway. If trauma is suspected, maintain cervical immobilization manually and apply a cervical collar and backboard when feasible. Victim removal. If victims can walk, lead them out of the hot zone to the decontamination zone. Victims who are unable to walk may be removed on backboards or journeys. If they are not available, carefully carry or drag victims to safety. Decontamination zone. Rescue protection. If the chemical or concentration is unidentified, personnel in the decontamination zone should wear some protective equipment used in the hot zone. Quickly ensure a patient airway. Stabilize the cervical spine with a collar and a backboard if trauma is suspected. Administer supplemental oxygen as required. Assist ventilation with a back valve mask device if necessary. Basic decontamination. Victims who are able and cooperative may assist with their own decontamination. Remove and double bag contaminated clothing and personal belongings. Flush exposed or irritated skin and hair with plain water for 3 to 5 minutes. For oily or otherwise adherent chemicals, use mild soap on the skin and hair. Flush exposed or irritated eyes with plain water or saline for at least 5 minutes. Remove contact lenses if present and easily removable without additional trauma to the eye. If a corrosive material is suspected or if pain or injury is evident, continue irrigation while transferring the victim to the support zone. In cases of ingestion, do not induce emesis. Victims who are conscious are able to swallow should be given 4 to 8 ounces of water. Obtain medical care immediately. Transfer to support zone. As soon as basic decontamination is complete, move the victim to the support zone. Support zone. Be certain that victims have been decontaminated properly. See documentation zone. Victims who have undergone decontamination or who have been exposed only to gas or vapor and who have no evidence to skins or eye irritation generally pose no serious risks of secondary contamination. In such cases, support zone personnel require no specialized protective gear. ABC reminders. Quickly ensure a patient airway. If trauma is suspected, maintain cervical mobilization manually and apply cervical collar and backboard when feasible. Ensure adequate respiration. Administer supplemental oxygen as required. Ensure a palpable pulse. Establish intravenous access if necessary. Attach a cardiac monitor. Additional decontamination. Continue irrigating exposed skin and eyes as appropriate. In case of ingestion, do not induce emesis. If the patient is conscious and able to swallow, administer 4 to 8 ounces of water if it has not been given previously. Obtain medical care immediately. Advanced treatment. Intubate the trachea in cases of respiratory compromise. When the patient's condition precludes endotracheal intubation, perform cricothyreoidotomy if equipment and trained to do so. Treat patients who have bronchospasm with aerosolized bronchodilators. Use this and all catecholamines with caution because of the enhanced risk or cardiac dysrhythmics after exposure to certain chemicals. Patients who are comatose, hypertensive, or have serious or cardiac dysarrhythmias should be treated according to advanced life support protocols. Transport to medical facility. Report to base station and the receiving medical facility the conditions of patient treatment given and estimated time of arrival at the medical facility. If a chemical has been ingested, prepare the ambulance in case the victim vomits toxic material. Have ready several towels and open plastic bags to quickly clean up and isolate vomitus. Multi-casualty wage. All exposed patients should be transported to a medical facility for evaluation. Asymptomatic patients who have not had direct chemical exposure can be discharged from the SEM after their names, addresses, and telephone numbers are recorded. Those discharged should be advised to seek medical care promptly if symptoms develop. Consult with the base station physician or regional poison control center for advice regarding triage of multiple victims. Inhalation exposure. Administer supplemental oxygen by mask to patients who have respiratory complaints. Treat patients who have bronchospasm with aerolized bronchodilators. Use this and all catecholamines with caution because of the potential or possible enhanced risk of cardiac dysarrhythmics. Skin exposure. If concentrated chlorine gas or chlorine-generating solutions contact the skin, chemical burns may occur. Treat as thermal burns. If the liquid compressed gas is released and contacts the skin, frostbite may result. If a victim has frostbite, treat by rewarning affected areas in a water bath and the temperature of 102 to 108 Fahrenheit, it's mean 40 to 42 Celsius, for 20 to 30 minutes and continue until a flush has returned to the affected area. Because of their larger surface area, body weight ratio, children and more vulnerable to toxicants absorbed through the skin. If the chemical burns are present, treat as thermal burns. Eye exposure. Ensure that adequate eye irrigation has been completed. Test visual activity. Examine the eyes for corneal damage using a magnifying device or a slit lamp and fluorescent stain. For small corneal defects, use ophthalmic ointment or drops, analgesic medication, and an eye patch. Immediately consult an ophthalmologist for patients who have severe corneal injuries. Ingestion exposure. Do not induce emesis. If the patient is alert and charcoal has not been given previously, administer a slurry of activated charcoal. If a corrosive material is suspected, administer 4 to 8 ounces of water. Do not give a slurry of activated charcoal. Consider endoscopy and to evaluate the extent of gastrointestinal tract injury. If a large dose has been ingested and the patient condition is evaluated within 30 minutes after ingestion, consider gastric lavage. Antidotes and other treatments. Treatment consists of support measures. Laboratory tests. Routine laboratory studies for all exposed patients include CBS, the complete blood count, glucose, and electrolyte determination. Additional studies for patients exposed to an identified chemical include electrocardiograph monitoring, renal function tests, and liver function tests, chest radiography, and pulse oximetry are recommended for severe inhalation exposure. Disposition and follow-up. Consider hospitalizing patients who have suspected serious exposures and persistent or progressive symptoms. Delayed effects. When the chemical has not been identified, the patient should be observed for an extended period or admitted to the hospital. And last part of our lecture, patient release. Asymptomatic patients who have minimal exposure, normal initial examination, and no signs of toxicity after 6 to 8 hours of observation may be discharged with the instructions to seek medical care promptly if symptoms develop. Thanks for your attention. Bye. See you at next week.